Hi, my name is Dr. Christine Klippen, and I am an emergency doctor at Friendship Hospital for Animals in Washington, D.C. Visits to the veterinarian are usually uneventful. They're a lot like our own annual trips to the doctor for a physical exam. Of course, not everything always goes according to plan. Accidents happen, and animals need medical professionals such as myself equipped to handle the unexpected, just like we would going to a human emergency room. That's where emergency veterinarians come into play. No 2 days are alike for emergency veterinarians. They might be treating a poisoned pet one moment and performing a life-saving operation the next. I see a variety of different cases to include trauma, such as hit by cars, fall from buildings, acute fractures, dog bite wounds, complicated medical cases, so things like pancreatitis, renal failure, blood disorders, diabetic ketoacidosis, intoxications, so things like rat bait ingestion, human medications, chocolate toxicity, difficulty giving birth, and acute vomiting and diarrhea cases. As an emergency veterinarian, I have access to more immediate diagnostic capabilities. I'm able to complete blood work on site, X-rays, abdominal ultrasound, and in some hospitals, advanced imaging such as CT or MRI. With sometimes very sick patients, I also have access to different medications and interventions that may be different from a general practice veterinarian. I routinely administer oxygen support, continuous rate infusions of pain medications, or blood pressure support and blood products. So when and why would my veterinarian refer to an emergency veterinarian like myself or a specialty hospital like the one I currently work in? Most emergency and specialty referral hospitals are open 24/7, so we are available anytime to see a sick or injured patient. Many general practice veterinarians have normal business hours and are unable to provide around-the-clock care with skilled veterinary staff. Your veterinarian may refer a case due to the need for closer monitoring all night long or access to some of the previously mentioned diagnostics. The other benefit of emergency veterinarians is that we work closely with other specialty veterinarians such as internal medicine specialists, orthopedic and soft tissue surgeons, cardiologists, neurologists, oncologists, ophthalmologists, and even dialysis capabilities. As an emergency veterinarian, I need to be adaptable. I never know what a client's expectation will be when they come in with a sick or injured animal. My recommended treatments may be out of their price range, unfortunately, at times, particularly if a client does not have pet insurance. But I do need to be able to be creative in these sort of situations, as well as to be able to think outside of the box. I need to be able to get information across in a succinct manner and gain the trust of a family to treat their pet. Many general practice veterinarians have the luxury of knowing clients for years. In my case, you likely have never met me before, and it can sometimes be challenging, especially if a pet is not doing well. What do I like about being an emergency vet? I enjoy the challenge of complicated cases that I need to think on my feet quickly. I enjoy not only knowing what the next case may be, it could be something as simple as a puppy with vomiting and diarrhea, or an animal potentially inflicted gunshot wound. I enjoy seeing those patients that have, again, beat the odds and recover to go home and be with their families. Emergency medicine is also very hard. Being available 24/7 means that I work long hours and sometimes in the middle of the night. I routinely spend weekends and holidays away from my family. I also deal with very emotionally charged situations and information that is sometimes really hard to hear, so I do not always see people in their best. At the end of the day, I love being an emergency veterinarian. I have had the opportunity to work for some of the amazing hospitals over the years and work with amazing people. Although there are sometimes not great days, I still enjoy coming to work. I still enjoy learning every single day from the people that not only surround me, but the pets as well as their owners. And the most important thing is I enjoy coming to work to be able to help my patients and their families. Thanks.